This episode is sponsored by Prep Dish. Prep Dish takes the stress out of putting homemade, healthy meals on the table. No more scrambling to figure out what's for dinner at the last minute. Make sure to head over to prepdish.com/fertilityfriday, all lowercase, to get your first 2 weeks of meal plans free of charge. This is the Fertility Friday podcast, episode number 117. Welcome to the 117th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. As you know already, I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works. And for those of you who want to go deeper into the realm of fertility awareness charting and body literacy, I have a number of programs that allow you to do just that. My January group programs have just started, so registration for the group programs is now closed. We had our first sessions this week, and I am just in awe of the amazing group of women that has come together for this program. And it's really been an honor to be able to connect these women with each other. And so I have two groups going, as you know, conception group and a birth control group. And I'm just really excited for what the next 10 weeks has to bring. So if this is the first time you're hearing about the groups, or if you weren't able to jump in this time, maybe because of timing, it just wasn't a good fit for right now. If you're wanting to jump on the wait list for the next round of groups, make sure to head over to fertilityfriday.com/group program for more information about how to do that. And I'm really excited to announce a brand new way to work with me. So I'm actually now offering a one-time in-depth fertility assessment for those of you who are fairly confident with your charting, but looking for a deeper understanding of your cycles. So wanting to go that extra step to get that deeper interpretation of what your cycles are reflecting back to you about your overall health and fertility. And so by the end of our 60-minute session together, you'll not only gain clarity and insight about your cycles and how they relate to your health history, but you're also going to leave with a plan, concrete next steps to improve your cycles naturally. For more information about setting up your one-time fertility assessment with me, make sure to head over to fertilityfriday.com/workwithme to book your session today. Before we jump into today's episode, I want to take a moment and thank my sponsor, Prep Dish. So if you haven't heard of Prep Dish, it is a meal planning service that makes preparing healthy meals for your family every night so much easier. So instead of coming home and scrambling to figure out what you're going to put on the table for everybody, Prep Dish sends you an email every week with a shopping list. So it's like, go to the store, buy these things. You come home, you spend 2 to 3 hours preparing for the entire week so that every night when you come home, you actually have everything ready to go. So it's really incredible. And one of the things that I know that my clients and a lot of my listeners struggle with when trying to adopt a healthy diet is what the heck to eat for breakfast. And so that's something that I've spoken about on the podcast a number of times. And I often find myself talking to clients about it as well, trying to nail down what to start the day with. So one of the things that I love about Prep Dish is that all of the meals are healthy. There are paleo options, gluten-free options. And so with that in mind, when you're preparing these meals, there's a really good balance of fat, protein, and carbohydrates. So you don't have to worry about those early morning, sugar spikes, especially if you're trying to balance your blood sugar throughout the day. So make sure to head over to prepdish.com/fertilityfriday to get your first 2 weeks of meal plans free of charge. So now let's jump into the show. And today I'm very excited to welcome my guest, Candace Syme, to the show. Candace is a graduate of the Midwifery education program at McMaster University in Ontario. And since first learning about midwifery in high school, she has been committed to becoming a midwife herself. She's always had an interest in healthcare and in particular the ideals of women-centered care. And Candace strives to honor the ability of her clients to voice their opinions and wishes for their care throughout their work together. Her goal is to make each client's pregnancy and postpartum experience one that is positive and supported and empowering. And of course, another awesome fact about Candace is that she was my midwife, and she was there at the birth of my youngest son about 1.5 years ago. So I'm super excited to have the opportunity to interview her, not only because she's a midwife, but because she's my midwife. And in today's show, we're going to be delving into what it is that midwives do. I'm really excited to demystify that. And we're also going to be talking a little bit about the philosophy of birth and midwifery care. So without further ado, welcome to the show, Candace.
Hello. Hi. Thanks for having me. This is awesome. Really excited to be a part of this podcast and and help get some more information out there about midwives and, of course, just to catch up with you, which is always nice.
Yeah, for sure. And so recently you've actually moved. So if there was a third, if that were to happen, you would probably not be my midwife again, which is really sad, actually.
Yes. Yeah. You know what? That's just as sad for me. The move has definitely been difficult, for the fact that there's lots of clients that are repeats that I may not get the opportunity to be at future births, but thankfully I'm very well connected to the clinic there. And, there's lots of fabulous midwives in Durham and, then I'll make new repeat clients here, which is going to be nice. So I'm actually working in the Burlington area now, joining the clinic called Burlington and Area Midwives.
Awesome. Well, I'd love to get started by having you share. I mean, I did go through the introduction and it gives the listeners a bit of a sense, but what inspired you to become a midwife? Why was that what you wanted to do?
Great question. I get that a lot about, what drove you to this profession. It is a small, tight-knit group of women that are working in the profession of midwifery at this time. And although we're aiming to grow the profession through the university programs offered in Ontario at McMaster, Ryerson, and Laurentian, we still have a quite tight-knit group. So it's not every day that you meet someone who is a midwife. So I do get that question a lot. And I think what brought me to the profession primarily was my passion for women's health. So I always knew that I loved helping other people. And I was really focused on the ideas of being empowered for your own care, being able to take charge of situations, and also making sure that women were the most comfortable possible. So I had previously looked into different areas of healthcare, and although they have wonderful benefits as well, midwifery I found had the best balance between all those ideas that I loved and also the medical side, which was really of interest to me as well. So I think that it allowed me to clinically be involved in a scenario, but also be a part of someone's story. And that was really important to me, to kind of follow things through from the start of the pregnancy to the end, build relationships, get to know people in the community. And that to me was the most rewarding aspect of midwifery and of becoming a midwife as my job.
Mm-hmm. Well, and we started to talk a little bit about this in the pre-chat, but I want to kind of jump right in and address some of those myths about midwifery care. So, personally, I knew I wanted a midwife like a long time ago. I'm one of those people that I was probably age 23. I was already like, whenever it is that I get pregnant, whenever it is that I'm having a baby, this is how I want to do it. I want to do it at home if it's possible, and I want to do it with a midwife. But obviously not everybody starts from that place. And I remember when I was telling people that I had a midwife, they were kind of like, well, what can a midwife do? And not really understanding kind of the level of qualification and exactly what it is a midwife is capable of doing. So I'd love for you to shed some light on some of those common myths about midwives.
Yeah, absolutely. One of the most common misconceptions about midwifery care is that we're purely a supportive role in labor. And that is not the case. So midwives are trained for 4 years in an extensive university program where we focus on health science courses and also core placements in the community to get lots of hands-on experience at births, in the hospitals, with other healthcare professionals to kind of well-round our knowledge and our experience in that field in particular. So midwives are expert care providers, primary care providers for low-risk healthy women in their pregnancy. So what that means is that when you become pregnant, if there's no adverse risk factors that would move you into a higher risk category requiring a high risk obstetric team, you would have the option of choosing a midwife as your sole care provider, who would then arrange blood work, ultrasounds, follow-up visits in a clinic setting throughout the pregnancy. They would also attend you at the birth. So they would be the ones that are doing all the care in the labor, delivering the baby, all the postpartum care. And then as follow-up, we would also be seeing the baby for the first 8 weeks or 6 weeks postpartum and about the first week or so at home for visits.
Mm-hmm. Yeah. And I think that's one of the huge benefits. I mean, we could talk about the logistics, but having an actual person who is there not only for the pre-birth and the birth, so all the appointments and everything that you attend. I think that's also kind of another myth that a lot of women think that if Because, of course, when you get pregnant, then it might be different in different countries. So I'm just speaking from my experience in Canada, but then your doctor kind of refers you to your OB, and then that's who you see. And so I think a lot of people kind of have that idea too. Like, okay, so then I'm seeing my midwife and my OB. And
yeah, we get a lot of questions about that. Like, okay, do we need to see our doctor or continue following up with our doctor? And the answer to that would be no. When you're seeing a midwife in your pregnancy, we are now the primary care provider. So we take care of everything for the pregnancy. Anything non-pregnancy related, you have a cold, you have a stomach bug, something like that, we would obviously be referring you back to your family physician. But pregnancy-related concerns, questions, and healthy well woman care is all done through us. So that's one of the big things that we hear a lot of the time. And to help kind of balance that situation out, the more that we talk about midwifery care, what we do in our profession, the more we educate other healthcare providers as well. Because some physicians do still, unfortunately, have that misconception that they need to continue following their clients as well. So what we actually do at our clinic is we send out a little letter to the family physicians explaining that we'll be caring for them. We'll send over any relevant records when the care is completed with us. So at 6 weeks postpartum.
Mm-hmm. Well, yeah, I think that's huge because and I remember, so another aspect, like for me, was that I was totally great and I had felt that I had a pretty decent understanding of everything. But, my husband at the time, it was all new to him. And so he had all kinds of questions, the logistical questions that I think we all have. And I think, I kind of joke that all of my friends that I went to high school with, and I don't mean all, but I'm kind of tongue in cheek, became nurses. Like they all did. And so when you have friends that are nurses, you hear all the horror stories and all the stuff. The joke is that nurses don't have a filter, but it's actually true. They don't. And they tell you all the stuff. So I had friends who were labor and delivery nurses, and one of my friends was a labor and delivery nurse in a particularly high-risk hospital. So she actually ended up seeing not a representative kind of view, but she saw kind of the worst cases because the worst cases were sent to her hospital because that was the hospital that handled those. So I think that there's also that idea that, like, what if something goes wrong? What if I choose to have a birth at home with a midwife and quote unquote something goes wrong? Maybe you could talk a little bit about and just how you actually talk to your clients about those concerns.
Yeah, absolutely. I think when clients choose to deliver in the hospital setting, there is some sort of sense of security that's just been set up through, the way that society's raised us to believe you're safe in the hospital. You've got everyone caring for you. And in some ways, those things do apply in certain situations. But it doesn't necessarily mean that the opposite applies at home, that if you're at home, it's now an unsafe environment. And there's actually studies to support that home birth and hospital birth actually have the same morbidity and mortality rates for low-risk healthy women. So that's not for your high-risk complicated pregnancy, at home. It's for your healthy women that, really we haven't seen anything that's come up alarming throughout the pregnancy. Nothing in the labor has presented itself as abnormal. And now this is a safe environment to do so. In terms of what would happen, should there be an emergency situation at home, midwives are trained in neonatal resuscitation. We're also trained in intubation of newborns. And we also have our emergency skills workshops that have to be up to date every 2 years for managing maternal complications such as bleeding, shoulder dystocias, high blood pressure, those kinds of things that we may see. And how we deal with those and get clients into the hospital is part of our regular protocol updating, and also the reason that we have 2 midwives at every delivery. So should there be an emergency that arises, we're able to have extra hands to help out. We always speak with our women that are planning home birth about emergency situations and how we would handle those. We bring all of our equipment to show the clients how that would be set up. And we actually bring all the same equipment to the home that they would have in the hospital setting. The only difference is that in the hospital setting, you do have additional hands other than just 2 midwives.
Mm-hmm. Well, and I think you raise a really important point as well, which is another kind of, I guess, common thing that I encountered when I would share that, a midwife was responsible for my care, is that idea that, well, if you have a midwife, doesn't mean you have to have the birth at home. And maybe you could share a little bit about the role that you have, regardless of whether the client has their baby at home or in the hospital.
Yes, great question. We do get that a lot about midwives. That must mean you're delivering at home. can't have an epidural and, there's no clinical care. So I've already touched on the clinical care piece of it. In terms of where you'd like to deliver, with midwives, you have the benefit of choosing your birthplace. So you are not held to pick either hospital or home based on the practitioner's preference. It is really up to you. We obviously voice our recommendations should there be high-risk situations where we would say this is no longer a safe place to deliver, and that is not what we would recommend. But for low-risk, healthy women with no adverse complications, home or hospital are both acceptable options, and it's really about what makes you the most comfortable. So for some women, being in the hospital gives them that sense of security. They know that's where they want to be, and that's absolutely where they should deliver. For other women, the idea of stepping foot in a hospital is very traumatic, and they're not comfortable in that setting. And for them, home is now the best option to be. And midwives can accommodate both of those. We hold privileges at local hospitals. Depending on which clinic you're seeing and which midwife you're seeing would depend which hospital they're affiliated with. So we're in the hospital setting a lot. We work hand in hand with the obstetrics team. So if there was complications either at home or in the hospital, we have that interprofessional relationship already established. So we're able to make for easy consultations or in some cases transfers of care, either from the home to the hospital setting or in the hospital setting from the care of the midwives to the obstetrical team should things become more complicated.
Mm-hmm. Well, and I'd love for you to talk a little bit about, who, because you've mentioned it, and that's one of the things that I always kind of share with people as well, which is that every human being is not an ideal candidate for a home birth. There are specific kind of criteria that are looked at to determine whether or not your pregnancy is high risk or low risk. So I'd love for you to address that, but I'd also like for you to kind of address it within that context. I think there's this huge societal misconception that birth in and of itself is dangerous, and birth in and of itself is an emergency, a high-risk event that by its very nature is dangerous. So I'd love for you to kind of address that within that context.
Yeah, absolutely. I mean, I think birth itself carries a lot of fear and anxiety, and most of that comes from the fear of the unknown. So we don't know how each individual woman is going to labor. We don't know the end result of how the labor will look. What we hope for in all situations with the help of a healthcare professional team is that we can make that a healthy delivery for mom and baby. The route in which we take to get to that is very different for each client, and nothing that we know until that day when you go into labor. And it all depends on how your body reacts to the labor, where is the baby positioned, how long have you been laboring for, and those are all reasons why we monitor labors and why you have healthcare practitioners present for labor and delivery so that we can try to reduce the risks and reduce the morbidity and mortality rates for moms and babies. So over time, obviously, those have dropped significantly with the interventions of healthcare practitioners. In terms of labor and birth itself, I mean, historically, this has been happening from the start of time, right? So it is a normal process. But because we're so used to thinking of anything that happens to our bodies as a sickness or as something that we need to fix, that's where that kind of misconception comes about birth being something that should be an emergency, which is not the case, right? So most women will deliver a vaginal birth and will have a healthy, well baby, and that is a very normal experience. Yes, does normal mean contraction pain? Does it mean some bleeding? Does it mean some days of soreness? Absolutely. But those are normal factors that we see for women that are pregnant and that are having babies. It doesn't mean that you're unwell, sick, need emergency care, need to be monitored all the time. That's in a healthy situation, right? So there is, of course, labors where there is emergency situations or there is things that arise that do need further monitoring where you may need to be in a high-risk center. And those do kind of appear to look more like, a sickness or being unwell. But again, that's just because of our ability to reduce morbidity and mortality rates with intervention, right? So that's why we do those actions. So I think that hopefully with more education for women about labor, about how our bodies work, about how the process of delivery actually happens. And a lot of times going through it can help with that process. But that sometimes helps reduce some of the anxiety about the process of birth itself, take away a little bit of the fear, and actually kind of empower women to say, you know what, I can do this. This isn't, a negative thing. This isn't something that my body's working against me. It's working with me. And that can be really empowering for women to think about it in a different way. But it does take a total shift from what we're kind of brought up to believe or society tells us to think about situations that are uncomfortable.
Mm-hmm. Well, I couldn't agree more. And you brought up that idea that a lot of women have, which is, I could never do that. Or yeah. I know I would need the drugs because I could never handle the pain, or whatever it is. What has been kind of your experience around that whole idea and how it comes into play in your work with clients?
Yeah, you know what? We do hear that a lot. And there is, quite a few clients that know right from the start, yes, I'd absolutely like medications in my labor to help manage the pain. There's others that are on the total kind of other side of things saying, absolutely not, I don't want anything in my labor. My personal perspective is really a little bit more open-minded because of the unknown of how your labor is going to go and how you're going to tolerate the labor. We do absolutely have access to those resources in a hospital setting, so not at home, but in a hospital setting, there is access to those things should you need them. But I think that often for women, that kind of blank statement before the labor, oh my goodness, I'm going to need this, that again comes from that fear. And throughout the pregnancy and our visits with clients, we try to reduce that fear for them, right? So let's talk about labor. What scares you the most? What makes you the most uncomfortable? How can we, reduce some of that anxiety that you have about the delivery process or about being in the hospital? And sometimes when we can break down those little parts, we find that women feel, okay, yeah, I can do this, or this seems a little bit more manageable, or, maybe before I came in to see you, I didn't think there was any way that I could even stay at home for early labor. No, I'm not doing it. And after talking about the advantages, the benefits of being at home for that portion, now they feel that that's a doable thing. So sometimes it's all about education, and sometimes it's just about support. And that's something that midwives are really passionate about, is really trying to work with each individual woman to figure out how are we going to make this uncomfortable situation of labor the most comfortable for you. Is that going to be in the hospital? Is it going to be at home? Is it going to be with medication, or is it going to be without? What information can we help provide to you, and what kind of support can we give you that's going to make this more empowering and positive for you, right? So I think it's just a lot of times about open conversation. And because we see our clients so frequently and there is that continuity of care, we're able to build a relationship where clients do feel more open to say, you know what, I've really been thinking about this, and this is what's concerning me, or this is what's making me uncomfortable. And that doesn't always come out in a 5-minute visit, right? So when we have longer visits, we're able to see them more frequently. There's more opportunity for that.
Well, and you're touching on something that I wanted to ask you about, which is that midwifery model of care and how it differs from, just the typical care that we get. And I know too, working with women in general, in whatever capacity, you want to be heard, you want to be able to raise your concerns and have someone listen and care. And you want to, and this is having a baby is such a, it's this life-changing, incredibly powerful, there's nothing in the world kind of like that. And so I wanted a little hand-holding. I wanted to have an actual relationship with the person who I was seeing throughout my pregnancy. And I really felt like I was being supported. I was able to ask all my questions. I was able to really just be supported. And so maybe you could talk a little bit about that midwifery model of care.
Absolutely. Midwifery care, aside from choice of birthplace, which we touched on, and sort of informed choice about allowing clients to express their opinions and decide what they would like for their pregnancy, the third kind of tenet of midwifery care is continuity. So really that's that we're seeing you from the beginning of pregnancy right until the end, which I sort of touched on previously. Aside from just seeing you for visits, there's that element of building the relationship, which I mentioned before was really important to me. So there's that ongoing support. There's ongoing availability. So midwives are available by pager system 24 hours a day, 7 days a week. Depending on the structure of the clinic that you attend, will depend whether you're seeing one midwife or a group of midwives, but someone is available to you all the time, which allows women to ask questions, get information if they're looking for it. Should there be something that comes up that's concerning them, labor, their water's broken, question about the baby, they have that familiar voice on the end of the phone that they can pick up and call. And I think for women, sometimes that is one of the most important elements of midwifery care, because they really do feel like, yes, this is my care provider, but this is also someone now that I've built a relationship with, I feel comfortable talking with. It's almost like you're speaking to a family member or a friend, someone that you really trust and value their opinion. Just so happens we also have this clinical side to us, of course, but there's that element of just building that strong friendship and relationship that helps us to continue the trust between both parties and also help aid in making the care a little bit more personalized for each person. So that aspect, I think, is something that clients really are drawn to with midwifery care. And once they've had a midwife, they can't really imagine what it would be like without that, because we do help you throughout the pregnancy, build that relationship. And, when we're at your labor, again, it's a familiar face. It's someone you've seen, you feel comfortable with. We already know what you're looking for in your labor and delivery. We've talked about what options are important to you. And so those things help ease that situation, make it a little bit more smooth.
Mm-hmm. Well, and you had touched on as well the appointments. You mentioned, hard to establish that same type of relationship with a 5-minute appointment. So one of the things that really stands out is, and again, speaking from a Canadian perspective, I know a lot of my listeners are in the US, some are, in Australia, the UK, but when you go to an OB, typically, I've heard the story, and it's not always like that, and I'm not trying to knock OBs, but a lot of women will say, my appointment was at 4, I didn't get in until 4:30, and then she only saw me for 5 minutes. So maybe you could take us through, you did walk us through kind of the appointments throughout the pregnancy, as well as extending to after the pregnancy. And I would love for you to talk a little bit about that, and also kind of share specifically about that support after pregnancy, because honestly, I cannot imagine not having that now that I've had it twice.
Yeah, that part's really nice. So I'll start with the visits prior to the baby being born, so your prenatal visits. We do structure our visits typically about 30 to 45 minutes. Again, dependent on the clinic that you're going to, that may vary a little bit, but in general, you get longer appointments. The reason that we're able to facilitate that is because we keep our caseload manageable for each midwife to be able to see clients for longer visits, to be able to attend all the births of our clients, and to be able to follow them in the postpartum. For obstetrical teams, they do take high volumes of clients, and that is probably a likely contributor to why the visits are much shorter. And that's why really it's important as a society that we educate more people about midwifery care, because low-risk women really don't need to access high-risk obstetrical teams. They have their benefits, they have their skill set, they're fabulous at what they do, but really their focus should be on high-risk women that need to see them. And so unfortunately for low-risk, healthy women that are looking for some more support, looking for a longer visit to ask more questions, to build that relationship, you may not be able to access that in that type of model just because of the way that they're structured. Whereas with midwives, our focus is on continuity, building relationships, women-centered care. So our visits remain longer in length so that we're able to accommodate for all the questions, concerns, and also our clinical stuff that we need to do as well. In terms of our postpartum visits, so with midwives, once the baby is born, we come to see you at home for the first week or so for visits. So those are pretty much every other day. Come to your home to check the baby. We bring the scale. We bring all of our equipment to listen to the baby's heart and lungs, temperature checks, blood work, jaundice testing, the Ontario newborn screen, which may not be relevant for your clients that are living overseas, but all of the testing that's available we do in the home setting, and also our checks on mom. This allows clients and their families time to spend at home with their family, getting to bond with the baby, establishing feeding, and not having to worry about driving out and waiting in a waiting room or coming back and forth. We try to mitigate that by making the postpartum really a time for families. We know that it can be very difficult and stressful the first couple of days you bring the baby home. And so having that ongoing support allows us to continue to follow up, make sure that you're having the right resources accessible to you, that feeding is going well, that your questions are being answered, and that, again, we're reducing the risk of any concerns for mom and baby not being addressed and that leading to further ongoing problems. So that's why we really focus on home care, very much focus on attending visits, frequently in the first week, and making sure that we're available by pager as well. So that, for a lot of clients, is a real benefit. Most clients have a partner or family member available during that time as well. But for some of our clients, that's not the case. So seeing their midwife every other day is really their only access point to ask questions, get help, make sure that the baby's doing okay. And that's really important to us, that we're there as a support system.
Mm-hmm. Well, and I recently recorded an episode which will be released next week. So it's episode 118. And I recorded that episode with a woman named Lori Eisenstadt. And she is a breastfeeding consultant. And so we talked a lot in that episode about some of the myths around breastfeeding, the idea that it's natural and that it's just necessarily going to be easy. And also the importance of having support and thinking, she said something really, really profound, I think, which is that the same way that we prepare for labor and birth. I know I took different classes. I took a prenatal class. I took a hypnobirthing class. I read up about labor. I watched videos. I really tried to prepare myself for labor. And I was even listening to kind of like the hypnobirthing visualization stuff before bed every night. I was really prepared for the labor. And then the breastfeeding kind of blindsided me, and it was super difficult. So one of the benefits that I found for myself, and I'm sure other women have found as well, is that because in the postpartum, you have the midwife coming to visit you, the day after, and then, 2 days or whatever the schedule is, those challenges that you have, they're mitigated if you have someone there right away that has the knowledge and information that they can either help you directly, or they can give you the resources that you need to get the help and the support that you need right away. That was invaluable to me.
Yeah, that piece, I personally do a lot of talking with clients about labor and birth and their options for that, and some things that can help them through that experience. Absolutely. But I really try to focus on the idea that, although the labor and birth is a huge, important day, then there's the days after that where you have this newborn baby, right? And if you haven't done any reading about newborn care, breastfeeding, how many times do you expect the baby to pee? That's going to be quite a steep learning curve. On top of that, add that you're tired, physically you're a bit sore, you're trying to produce milk. Those are all aspects that make those things a little bit more challenging. So I always encourage my clients prenatally to do a little bit of reading information, just like they're going to do about labor and birth, about what happens when the baby comes home. How do I breastfeed the baby? Is that important to me? What are benefits of breastfeeding? Also, what do we do for the baby? When do we bathe the baby? How do we, know that the baby is doing okay? And we can direct clients to appropriate resources for these things. But I just think it's important to do a little bit of information, and reading prior. But for clients that haven't done that, or even still, a little different reading about a baby than having it in front of you, the fact that we're seeing you so frequently, we're able to give you information that's direct and applicable to what's happening at that time. So we may say to you right after the birth, here's what you need to know for the first 24 hours, and that's it. And then we're going to be seeing you, and we'll tell you what you need to know for the next 48 hours until we see you next. Then it gives clients those little touch points to feel like they're having some ongoing support. They're getting follow-up knowledge and information. And like you mentioned, should there be complications, concerns that arise, we're able to detect them early and make appropriate consultations or appropriate care plans so that it doesn't become an ongoing problem. And one of the biggest ones we see is with breastfeeding. So the fact that we're seeing you so frequently allows us to aid with breastfeeding support, which for some women, if they're only seen at the hospital and then they're discharged home, not seen until their 6-week visit, complications with breastfeeding that arise may just lead them to say, okay, yeah, this is not for me because this is way too hard, or I don't have milk, or my nipples aren't the proper shape, or whatever the complaint may be. Whereas when we're there, we're able to talk you through those concerns, help fix the problems. And if that's something that's important to you, we're going to support you as much as possible to make sure that this is successful for you.
Mm-hmm. Well, and it's not incidental in the process. My experience of it was that these are specific things that you're sensitized to, and you're checking in about all of them. And you have, I don't know how you do it, but from your pain level to how your uterus is healing, contracting up after birth to any, just a different level of care. And it's really like, it's like what you need. That's the easiest way to explain it, because you're not capable at that stage emotionally to really determine what you need. I'm just going to say it. I mean, you've been with so many women right after birth. I mean, are they capable of determining what they need in that emotional space?
I mean, you know what? That's a great point. Sometimes, yes. Most often, not in the way that they necessarily can vocalize. Partners are sometimes a great resource for that. But because it's often clients' first time going through this, sometimes there's even this feeling of, this is what I'm feeling, but I'm not sure even what question to ask or what to ask for, or what I should be feeling right now. And so we try to cover all those topics when we're seeing clients at home. And like you mentioned, touch on all those clinical aspects and make sure that everything's covered so that you really don't have to think about that. All you have to think about is, enjoying the first couple days with your baby, trying to get the baby breastfeeding or feeding in some way, and, following the directions that we've given in terms of what would be concerning to let us know about. And so that sometimes for that in itself, that can be a reassuring aspect for clients. It's like, okay, I've got all my kind of set things that the midwife has said that I should be looking for. If these are not happening or everything else is looking good, we can kind of breathe a little bit easier for the next couple of days. And then the midwife's going to see us again. And so I think sometimes that helps clients get through that period of time, because it can be really difficult. And what we do know is that most women, almost 80%, experience some postpartum blues between day 3 and day 5. So that's where women are having a lower mood, sometimes a bit weepy, emotional, exhausted. And that in itself is a normal process, happens when there's a hormone fluctuation, milk is being produced, you've now had a couple days without rest. Absolutely. But without adequate support, those couple days can be really, really difficult and also can be detrimental to breastfeeding success. So if we have a client that's not well supported, feeling down, feeling emotional, feeling sore, and has nobody that they feel that they can turn to provide support, to provide encouragement, that in itself is sometimes where breastfeeding kind of falters, right? So we try to provide adequate support, resources, phone calls, visits to help clients through that period of time. And then things start to get a little bit easier for clients. Usually, a week postpartum or so for most clients, they're feeling, mood-wise a little bit better. Feeding is usually a little bit better. The baby's usually gaining a bit more weight, a little bit more settled. They're settling into, being a new mom. And that can sometimes kind of when they start to see the light. And that's kind of our goal, right? So we help you through that process as much as that takes. Like I mentioned, usually visits every other day for the first week. But if our clients need more visits, more follow-up, absolutely, we will accommodate that. And that's the flexible thing about seeing clients in their homes. You're not bound to a schedule saying, okay, we can only see you at 11 a.m. We have flexibility. You don't have to leave your home. We make it work for the clients.
Mm-hmm. Well, and so I want to talk about access now, because I used to live in Alberta, and I'm sure, like, I don't live there anymore, so I don't know exactly what is going on now. But so that was, let's say, what year was that? 2009. So that would have been, say, 7 years ago, or 7, 8, 9 years ago, whatever. My understanding at that time in Alberta in particular was that midwifery services were not covered by Alberta healthcare. So like I said, this has changed. I'm pretty sure it has changed. But at that time, if I had been in a position to have a baby and I wanted to have a midwife, I would have had to pay, and I think it was $2,500, like at that time. Yeah. And so in Ontario, obviously it's covered by healthcare, and it's just part of, it's the same as going to a doctor. So in Canada, though, going to a doctor doesn't cost you money because it's part of our system. And so when I came to visit you and see you, I didn't have to pay you money out of my pocket. Do you have any comments around, like, for other women in other places of the world, and because I'm sure the access is different, and you may not be able to comment on that, but I just want to take a moment and kind of acknowledge that everyone listening may not have the same degree of access.
Yeah, absolutely. I mean, access to midwifery care in Ontario, we have a great benefit of being funded through OHIP, so our clients do not have to pay out of pocket to see us. And that is a big myth of midwifery care, is that you do have to pay for our services. And so we try to debunk that kind of right away. You don't have to pay to see us, and you don't need a referral from a physician or an OB to see us. You can self-refer. So when you're pregnant, you pick up the phone, you call us, usually best to call right away because we do fill up quickly. And that will secure your spot and you don't have to pay any additional funds. One of the other benefits for midwifery care in Ontario in terms of access is we actually provide care for non-OHIP clients. So clients that are new refugees, immigrants, we cover care for you. So it essentially gets billed through a different section in the government. So we still get paid for those clients, but the clients themselves don't have to pay out of pocket for our services. So they would still be able to see us, access care throughout the pregnancy, for the birth and the postpartum, free of charge. The only fees they would have to pay additional would be any hospital fees or additional fees for ultrasounds and blood work. And there is actually a separate portion of funding that is allocated for clients that don't have OHIP to help supplement those costs. So in the end of it, those clients won't even have to pay for all of those services, just some of them, if they exceed the allocated fundage for them for their pregnancy. So that is a real benefit for people trying to access care and not sure what's available to them, and depending on their financial situation, what is cost effective as well. And midwifery care does allow clients in those situations to take that one burden off, which is the financial piece.
Mm-hmm. Well, and do you have any kind of, in terms of like training and practice, do you have any sense of if it kind of goes across the board or if it varies depending on where a person is in the world, the way that midwives, kind of the way that the services are integrated for them?
So I'm probably not the best to speak on each specific place, but I do know country to country that obviously varies. Dependent on the type of training that the midwives have, a lot of countries are nurse midwives, so they do kind of a split program, a couple years of nursing, a couple years of midwifery, and some nurse midwives are employed through the hospital. So that schedule looks totally different. Sometimes there's not quite as much home care. It works a little bit more like shift work. In other countries, midwives are paid fee for service, so clients do have to pay out of pocket for them. But that is very different here in Canada, and specifically in Ontario. So that piece does look different where you are located, dependent on the type of support, the amount of midwives in that area, and the type of system through the government. So is there healthcare for clients in that country, or is paying for services something that's more the norm? That could vary a little bit. Here in Canada and Ontario, for most that are living here, we have healthcare covered, and this is one of the services that's included under that umbrella heading.
Well, and something that you said that I quickly wanted to touch on. So you were talking about like the care under OBGYN. Yep. And so now, forgive me, but my understanding of an OB is that they are a surgeon. Is that correct? Like an OB?
So an OB, so someone that's in obstetrics in particular, they are specialists in surgery for obstetrics and gynecology. So that's things like a C-section, that's things like cyst removals, DNCs, hysterectomies. They do all of that. Sometimes certain obstetrical physicians focus on one point of care versus the other. So some obstetricians don't work in a hospital setting. They would only work in a clinic. Others work in the hospital setting doing rounds on call. And so, for example, the obstetricians that we work with work in a hospital setting and in a clinic setting, providing care for their clients prenatally, postpartum, and also on call in labor. So they kind of rotate through that type of schedule. So yes, they do surgeries, but they also have lots of other skill sets to offer. So they still do provide prenatal care. They still do care for clients that are not pregnant, that have obstetrical or gynecological concerns. And some of them also focus with fertility as well.
Well, and I think, where I was going with that as well is, because what you had talked about as well is that when a woman has been identified to be in a low risk pregnancy kind of group. Yep. I think that because I didn't, to be honest, like, so, personal disclosure time, like I don't know everything, but I didn't really fully understand like what the role of an OB was. So given that an OB has been trained in that surgical, like it's exactly what you said with respect to, they're specialized to handle high risk situations, like for the things that go wrong, like, and in terms of the cost of care in general, since we're talking about whether it's funded, whether it's not funded, I would imagine that, and I could be wrong, but I would imagine that the care, in terms of from the perspective of the whole health system, like if a woman is accessing care through a midwife versus an OB, when she doesn't require that specialized care, or at least hasn't been identified to yet, to require that level of care, I would imagine that it would kind of, I don't know, free up some of those funds because
it does, yeah. So midwives do cost the government less because of the type of care that we're providing, in terms of the fact that a lot of it is out of hospital setting. So, right, that drops the funds down significantly. But also, it's the fact that we're caring for lower risk women, and often there's not as much intervention required. We're not using as much, laboratory work, ultrasounds, blood work. We're not doing quite as much of that. That can help lower the cost as well. And also just our fees in general are lower than obstetrical teams. So in terms of the government cost effectiveness, absolutely midwives, that is a benefit to the government, having more midwives working in Ontario, for sure.
Well, and just from your experience now of your years of being a midwife, maybe you could share just, there's cost benefits, there's other benefits, but how do you think that having access to midwives and this type of care, I mean, we've talked about it, and I think by now the listeners are starting to really appreciate that when you're able to receive the care of a midwife, it's coming from a different perspective than what we're used to in our medical system. It's really coming from that perspective of taking care of the woman and making sure that we're looking out for mom and baby. I mean, that's basically what it's coming down to. So yeah.
And I think there's definitely that same goal from the mindset of the obstetrical team of healthy mom and healthy baby. Absolutely. I have no doubts about that. It's the approach in which that's done that is different. So, everybody's preference is a bit different, and that's what midwifery care is really focused on. And that's really, I think, the major difference is really that we're focused on what works for you. How can we make this more comfortable for you? How can we better accommodate you and the concerns that you may be having, or, the barriers that you may have to accessing adequate care? How can we try to break those down? And that piece is the part that looks a little bit different. It's not to take away from, the value of the obstetrical team, absolutely, but there is that piece that this is the way things are done and this is how they're going to go in most cases. With us, it looks a little different. We're a little bit more flexible about what clients are looking for. And because we're really passionate about empowering women to take charge of their care, there is that piece that not everyone's care is going to look the same. Not everyone's visits are going to sound the same or look the same. And not everyone's birth is going to be the same way, right? So that's kind of where we're a little bit more flexible and how that piece looks a little bit different.
Mm-hmm. And then is there kind of a hard line of who can see a midwife and who can't? So who is absolutely just in a kind of more high risk situation that automatically needs to have an OB as opposed to a midwife?
There is certain situations, absolutely. We have quite an extensive list if you look up on the Association of Ontario Midwives to discuss who's proper candidates for midwifery care. But most cases, clients that haven't had a really complex health history, haven't had really traumatic birth experiences, or several emergency situations happen in previous pregnancies, those would sometimes be barriers for midwifery care. But often what we can provide for clients is if a client comes into our care We do our initial visit with you. We see you for some visits and a complication then arises or something then presents itself as complicated. What we actually do is usually a shared care model, which means that you would be seeing the obstetrical team for the high-risk complications. You would still see us for visits, and we would still come to the birth either as your practitioner, should that be something that we've decided with the obstetrical team that would be appropriate, or we would come as a supportive role. So once you're with the midwifery team, we never leave you. We never ditch you out of our care. We're always there in a supportive role at the very least. So if there is complications that arise, you don't have to fear that you're not going to still have the support of the team. It may just not be in a clinical way. So for some clients where it does become high risk, after the delivery, when things have gone back to a low risk level, we still see you at home. We still do baby follow up, and we take care back over for you. And that's quite common for our clients that do have high risk complications.
Mm-hmm. Well, and there's a couple of questions I want to ask you before I wrap up as well. But before I do that, I wanted just to get a sense of then what it's like for you kind of like in the moment. So in the actual labor process. And also I think that there's a misconception that a midwife is kind of like a doula, like that you're there. I feel like those roles are a little bit different. So maybe you could clarify your role at the birth and talk about what that experience is like.
Absolutely. So doulas are great support systems in labor. So they work with clients for how to make their labor more comfortable. So counter pressure massage, changing positions. Some doulas also focus on postpartum care and breastfeeding as well, and they can be a great tool to help supplement our services. The major difference between a doula and a midwife is a doula does not provide any clinical care to the client or the baby. So that's where midwives are different. So we do all the support and encouragement, breastfeeding help, same as the doulas would. Plus, we do all of the clinical care as well. So in a typical labor with a midwife, really you'd only be having the one midwife in the room with you throughout the entire labor. And then when you're getting close to having the baby, we call another midwife to come help us. So 2 midwives in the room at the delivery. There's no additional nurses. There's no doctor in the room. It's just the 2 of us and the client and whoever other family members or support they have in the room with us at the birth. So we do all of the support piece of the labor and also the clinical aspects. So vaginal exams, IVs, catheters, blood work, whatever it may be, suturing after the baby's born, managing emergency situations. That's all done through us. So that's the real big difference between a doula and a midwife and how our role looks in the labor. So when we show up at the hospital, we kind of do the role of the doctor and the nurse. So for clients not accessing midwifery care, they would have a nurse with them throughout their labor, and close to the delivery, that's when the OB or the physician would come in to deliver, and then they would go back to nursing care, keeping in mind the nurses would be giving report and speaking with the OB throughout the day, but it would be more with the nurse throughout the day. Whereas with us, you're just with us.
Okay. Well, and I want to kind of tease into your experience a little bit about actually being the person present when, that first moment of life. Like, what has that been like for you to be part of the process? Like, does it get lost in the mix because you have a zillion things on your mind that you're responsible for, or are you ever able to kind of savor in those moments? You know what?
That is something that we get asked a lot about, but I don't think that even me talking about it really does it enough justice, how amazing and incredible that is to be a part of that experience. So I think I speak for most midwives when I say that, the midwives that are working and providing care for clients, it's because they really love the work that they do. So there is long hours, you are up and you're with clients and you're, at the hospital and at home and driving around. Absolutely. But it's always worth it when we see a healthy mom and a healthy baby. And I think for myself personally, being able to be a part of that experience and being invited to be a part of someone's birth is so rewarding. And to me, that never gets lost in the other aspects. I think I always take a moment to kind of look at that baby and look at the mom and their family. And for me, that's reward enough for the work that I'm doing.
Mm-hmm. Oh.
So Yeah, I know, right? Like that, I mean, I could talk about that all day, but I really do feel really fortunate to have been a part of so many births throughout my time as a midwife. And I know I have a long career ahead of me, but yeah, that part is really, for me, what makes the rest of the job so worthwhile is being able to see families come together, being able to see, how women are able to take ownership for their bodies, take control over their healthcare and, what they want for their family. And for me, I just feel like every situation is so unique, but in the same way, we're all connected, right? So once you've been at that birth and you've seen how that happens, now you're a part of this new environment. You're a mother, you're a new family, and being a part of seeing how all those different situations play out is really lovely. And I wouldn't have it any other way.
Mm-hmm. Yes. And the impact kind of from the other perspective, the impact that you have, I mean, I can't imagine what it's like because then over the course of your career, thousands, tens of thousands of women that you're attending their births, right? And so after, 30 years of a strong midwifery career, you probably you cannot remember each individual person. You know what I mean? Like over like a 10, 20, 30-year career. But then on the flip side, for the actual person, the mom who you supported through that birth, she'll never forget it.
Yeah, and I mean that's one of the great things about the type of work that we do, right? So, although our lives may go different places, or we may not see you for a future pregnancy, or for example, like me moving out of town, absolutely, our paths may go different ways, but you always have this shared experience together. And I think that although each individual midwife may not remember every single person's name and face that they've been at their birth, it doesn't change that those moments were really special and really important at that time. And, we always love to hear from our clients. Even sometimes it's, hey, I don't know if you remember me, but you were at my birth, and we say, oh yeah, we were there. And it's always nice to rekindle those moments when we can, because it's a really special experience. And we really do feel honored to be a part of that. And it's always nice to see that follow up, right? A lot of midwives, like I said, that work in the job we do, we love having that continuity. That's so important to us. So after that 6 weeks, we're just as sad when you're leaving care, right? So it's always nice to have that follow up. And like with you, I mean, I hear about how you guys are doing a year and a half down the road, right? Mm-hmm. So that's always a really nice part of our job as well, to kind of see where our paths may connect in the future.
Mm-hmm. Well, yeah, in this day and age, things are a lot different and often more challenging to find those kind of more meaningful kind of professional relationships, right? So, so to kind of wrap up today, given our discussion, everything that we've talked about, we covered so much. What would you want our listeners to take from this conversation?
Well, that's, hopefully, the listeners have gotten an opportunity to get kind of like a little snapshot picture about midwifery care and the type of work that we do. Obviously, there's so much more that can be talked about and explored. And I encourage everyone to, do more information and research about midwives in your community. What kind of services do they offer? Most healthcare professionals, midwives, and other healthcare professionals for that matter, would love to answer questions. If you give them a call and say, hey, I'm looking at the services, what does this involve? And really, it's all about education and building a stronger understanding of what's available to you, right? Midwives are all about, choice of birthplace, informed choice, continuity. We always want to focus on what the client is looking for. And it's the same for anything in healthcare, right? So it's just, maybe questioning some of the so-called norms that are in your community and trying to say, okay, what else is out there? Does this work for me? And if it doesn't work for me, how can I make this a bit of a better situation for me and my family? And midwifery care is just one of those ways that we offer different choices to you. And it's all about choice. And so I encourage, everyone to look into it more. And if you are pregnant or thinking about being pregnant and you think this may be something that may be important to you or that you're interested in, absolutely call the local clinic in your area, get more information, put yourself on a list to meet with the midwife, because it may be something that really makes your birth experience a little bit more empowered.
Mm-hmm. Well, and so last question of the day then, for a woman who is pregnant, or maybe she's, planning to get pregnant at some point, what is something after all of your experience, all the births that you've been to, your career, your education, all of that, what do you want women most to know about pregnancy and birth?
That you can do it. You can do it. There's this feeling sometimes, like I've talked about so much about, we're set up to sometimes fail, and with pregnancy and birth, there's a hard road ahead of you, but you can absolutely do it if that's something you want. And, really savor those moments that you have when you're pregnant, when you're in the postpartum, when you're with your new baby, because it really is a miracle how that all happens, right? So I think sometimes we get caught up in the busyness of life and social media and emails and all this stuff that keeps our mind focused, but really focusing on those simple things and those simple moments, that's what makes life so important and so rewarding. So really focusing on that and that will kind of help you get through the difficult times too.
Oh, Candace, thank you so much for coming on the show. It was so much fun being able to pick your brain.
Yes, no, thank you so much for having me. It's always so nice, like I said, to talk about everything and get some information out there, and hopefully it was helpful and I didn't ramble on too much.
Oh, no, this interview, I'm so excited to share it because I think that where does anyone have the opportunity to really pick a midwife's brain for an hour and get like all the kind of nitty gritty on exactly the processes involved, what it looks like, training, education? I think that this is going to be so informative for so many women.
Oh, I hope so. I'm really, really excited about it. So I'm really excited to hear it in February. And yeah, it'll be really nice to see how it goes.
Well, for sure. And then for any of the listeners who want to learn more about you or what you do, or if there are any listeners in Ontario, which I know that there are, women who kind of are like, oh my goodness, now I want her to be my midwife. Where can they go to? And she's awesome, by the way, from personal experience. But where can they go to find out more information?
So to find out more about which midwifery clinics in your area that may be accepting clients, you can look on the Association of Ontario Midwives website, and there's lists of all the clinics and their contact information. If you're looking for a specific midwife, you can also find out which clinic they're affiliated with. For me, I'm working at Burlington and Area Midwives, which is in the Burlington area, serving women in Burlington, Waterdown, Oakville type area.
Okay, well, thank you so much, Candace. It was just so much fun to be able to chat with you. Thank you for listening. If you enjoyed today's show, please share with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/117. I hope you enjoyed my interview with Candace Syme, my personal midwife. It was so great to be able to have the opportunity to chat with her and just to have her dispel some of the common myths that I've heard around midwifery care, especially with regards to their qualifications and their capabilities, what they're able to do, and whether or not they're able to handle emergency situations. So I think it's really important to dispel some of those myths because although I can't speak for the training all over the world, I know that in Canada, midwives are trained to handle, just as Candace was talking about, all the different types of scenarios that can come up in a birthing situation. And beyond that, women are screened throughout their pregnancy. And so if there are any factors that might make them not a good candidate, say, for example, to have a home birth, those factors are identified well in advance. And so, yeah, I'm really happy that you were able to hear a little bit more about the midwifery model of care and the way that it's basically mom and baby centered care. I really liked how Candace talked about the continuity aspect, which is huge. Because then, and it is sad after your 6-week visit that you no longer see your midwife anymore in postpartum after you've delivered your baby. Because in a way, if you think about it, you've been seeing your midwife or midwifery team, depending on where you are. I know where I live, the midwives, they work in teams. And so you have a group of 3 midwives and, each appointment you might see a different person. And so you know that at your birth, you're going to see one of the 3 typically women on the team. And so Candace wasn't my only midwife. There were actually 2 other midwives, and she just happened to be on call during that week that I happened to go into labor. But that aside, you are in contact with your midwife or your midwife team for basically almost a year. All the appointments and throughout pregnancy, initially you're seeing them every month, and then the schedule changes as you get closer to your due date, and you may be seeing them every other week, every week at some points. And then of course you have a multiple amount of visits after the baby arrives. And so you do form a really strong relationship. And so I'm really glad to have shared that on the podcast, and hopefully just giving you a bit of kind of clarity on what it is that midwives actually do, what type of care that they offer, and also at least to give you that knowledge and awareness that you can check it out in your own area, see what's available to you. And if you're not sure what is available to you in your area, you can certainly reach out and contact midwives in your area, have a conversation with them, and find out what services that they offer. And so if you've been enjoying the podcast, please do look for it on iTunes and leave a 5-star review so that more people can find it. If this is your first time listening to the podcast, make sure to hit subscribe so that you'll always be notified whenever there's a new episode of the Fertility Friday podcast. And make sure to head over to fertilityfriday.com and join my email list. As a gift to you for signing up to my email list, you will receive a copy of my ebook where I reveal what to expect when you're coming off of hormonal contraceptives, and I share 5 steps to restoring healthy menstrual cycles post-pill. If you have an idea for a podcast episode or a guest suggestion, make sure to send me an email at info@fertilityfriday.com. I'd like to thank you so much for taking the time out of your day to listen to the show and to support the show. I really appreciate all of you taking the time to tune into the podcast. I really appreciate all of you for sharing the podcast with your friends, tagging each other on social media, and really just getting the word out. And so thank you again. And as always, until next time, be well and happy charting.